welcome.
Veronica.
Good afternoon. I am Veronica Murray, and I am the Diversity, Equity, and Inclusion Manager for the Department of Consumer and Business Services. And I've been a member for almost a year, I think. And I've been with the state for over 25 years.
And Angela?
Yes, hi. I'm Angela Ward. I'm a business process analyst with the Department of Fish and Wildlife. And I've been on the PMAC board for about 2 years and a state employee for just shy of 15 years.
And Emily?
Hi, everyone. My name is Emily Wong. I'm the newest PMAC member, so I think this is my second official meeting. I'm in a job rotation right now. It's a very unique position. It's unique in the country. It's a OHA, Human Services Coalition Contract Specialist, Labor Relations Liaison. So it's a partnership between DAS, OHA, and SEIU. And my regular job, though, is at Oregon Health Authority as the Office of Equity and Inclusion, as a health equity policy analyst, also a tribal liaison for the last 3 years. And I've been at OHA since 2011. And then I've been in state and local government for about 25 years.
Welcome. And just for the committee's information, Emily really jumped into the fire quickly. She's been meeting already with Teresa and I behind the scenes, helping to gather information for our next set of presentations. So welcome, Emily.
Thank you. And yes, and I just wanted to add, I apologize in advance. I have to leave at 3:30 because I'm also the co-chair of OHA's People of Color Employee Resource Group, and we had a standing meeting already there.
Okay. I think we may get out of here by 3. Of course, if there are a lot of questions for the carriers and folks want to stay on, we have the time reserved until 4 and we can certainly use it. We don't want to interrupt any good dialogue that occurs. Lisa, were you able to join and introduce yourself?
Yeah, sorry about that earlier. I couldn't get my laptop to open up and turn on my camera. So I'm Lisa Hayes, and I work for the Oregon Department of Transportation. I'm the AEE voting member on PMAC. And I'm out here in rural Oregon. I've been with the department for 17 years and on PMAC going on like 4.5 years now.
Great. And are there any PMAC members who joined since we started introducing ourselves? All right. So Stephen, I'll hand it to you, and I'll just also give it, want to notify all the attendees. We are recording this meeting. And I think we do have some staff who will be interested in viewing this meeting as well as our upcoming meeting. So just an FYI, we like to announce that ahead of time. Stephen, why don't you take it away?
Thank you, Brian, and hello, everyone. Glad you're here today. And as you know, we introduced the framework for development of the Health and Wellbeing Initiative in the state of Oregon for PEB in previous meetings for both the PMAC and the Worksite Wellness Coordinating Council. And this presentation, or this series of presentations today from your carriers, is part of the initial discovery process. If you recall, we are starting with discovery, moving into strategy, and ultimately into taking action on executing on that strategy. But the first part of the process is discovery. We started last week, and we really appreciated Emily Wong's insights and the feedback that she brought, as well as Brian brought some ideas from his personal interactions with members who've been impacted by COVID, and generally speaking, what their status of well-being is in their work and outside life. So today we are bringing your 3 major carriers, Kaiser Permanente, Moda Health, and Providence Health, to be able to share with you, insofar as they can, some of the utilization of their services over the last several years, pre-pandemic, ideally into the pandemic and post-pandemic. And some of them have some limitations around that, since some of their programs didn't start until somewhere into the pandemic or even more recently. But we ask them generally to provide utilization of the programs that they have available now, so we'll understand what they have available, as well as what they're looking to implement in the foreseeable future, next year and beyond. And what which of those services might be of interest to PEB and your organization in general. So what we'll look to the members of PMAC and the council to do is to look at these things, look at these services, ask questions of the carriers, and ultimately we're going to ask for your feedback about which of these services you think we should really help promote more vigorously through PEB and through the various state channels, and ultimately how we should keep these things in consideration as we move forward to identify our well-being strategy and execute on that. So again, encourage you to be highly interactive with the vendors, ask questions, and I know they will prompt you as well. We've roughly assigned 40 minutes for each of the carriers to make their presentations. So we have some flexibility around that depending upon how interactive you want to be. So with that, I'm going to turn it over to the Kaiser Permanente team and ask you to take it away, please.
Hi, this is Sapari Servant. Thank you so much. Thank you, Troy. Troy Marco is also on our team. He's helping us drive the presentation today. We'll just start with quick introductions. And actually, thank you so much for inviting us here today. We look forward to some discussions with you. And again, please feel free to interrupt us at any point during this presentation to clarify, or, you know, if we're not answering the questions that you set out for us, please feel free to ask. My name is Sapari Sturdivant. Again, I am the account manager. I work on the PEB account, and like Brian, I'm not good with numbers or lose count or have lost count, but I believe I've been working on the PEB account for over 8 years now, so very, very familiar with this account. And with me today, I have a couple of my colleagues, and I'll ask first Dr. Bachman to introduce yourself.
Great. My name is Keith Bachman. I'm an internal medicine physician. I practice in Portland, Oregon, and I've been working with the PEB account for mostly the last 8 years. I help connect the dots with our largest groups between the care delivery that people get at Kaiser Permanente and the needs of our employer groups, and thinking about wellness and thinking about care delivery. And it's certainly been quite a ride with COVID and all the new challenges that's been presented to our members, my patients, and the employer groups that I work with. Thank you for having us today. It's a great topic. It's the best topic we've been asked in a long time. Like, what's going on with the health of our members over the past 2 years? It's a great chance to take a look at that now that we're in a little bit of a COVID lull.
Thanks, and Amber.
I'm Amber Robson, and I'm a senior workforce health consultant, and I am the newest member to the team. I just took over PEB, I think about 1.5 years ago, so still getting up to speed, but seeing some familiar faces and working in the wellness space and supporting with various resources and strategies and just being a sounding board along the way.
Perfect. Okay. Troy. Oh, thank you, Dr. Johnson. I know that Stephen talked about, you know, the kind of the topics for today, but, you know, again, as I mentioned, if we haven't answered your question, please feel free to let us know. But what we're going to start with is in providing you with some data. You asked that, you know, what are the changes we are seeing pre and not really post-pandemic yet, right? But we're in kind of the next normal phase. So we definitely have some data to share with you on that. We will also talk about the programs that we currently offer to our entire population, in addition to some distinguishing differences with the programs that we offer PEB or that's available to our PEB members today. Talk about some new initiatives that we recently launched late last year and early into this year that can help support our member in their care journey. And then Amber will talk about, you know, what we can do together in collaboration to kind of help promote and support these programs, starting, you know, now and beyond. And then lastly, efforts around what we are doing around our prioritized population. Lots and lots of things. We, you know, knowing that this is a 40-minute presentation, we are kind of bringing in kind of the high-level highlights. So if there's anything in here that you want a further description or deep dive on, just let us know. Okay.
You may be invited to future meetings, everyone. This may not be a one-off.
And we welcome that. Okay. This slide here just kind of want to set the stage to let you know what the PEB demographics looks like. So we have over 10,500 employees, PEB employees on our plan. With that, there are approximately over 25,000 members. And what we're doing here is kind of comparing PEB, which is under the Your Group column, to our Kaiser regional average. So our book of business here in the Northwest region. With the average subscriber age, PEB is slightly older than our book of business. The average member age, however, is a bit younger, and you'll see the reason why for that is because the average family size, a couple rows down, is a bit larger than our book of business. And then the enrollment stability, so just a brief on that, that really means that for those members who have KP coverage, over 93% of them continue on with KP coverage. So this is looking at the prior year as compared to this year. And this percentage actually, you know, when we look at year over year, it stays in kind of the high 90 range. So which is a great thing because, you know, we get to continue to care for the member for the long haul. Any questions here? Okay. Next slide, Troy. Perfect. And this is just a quick visual, a quick overview for you. I mean, just to get a snapshot of what it looks like, again, pre-pandemic, during the pandemic, and again, now in the new normal. So the blue represents the inpatient visits, and this is on a PMPM basis, so just by dollar value. As you can see, for the inpatient visits, it did slightly go down in the 2020 period during the height of the pandemic. However, in 2021, that has increased a little bit, or increase to the levels of the pre-pandemic. The orange bar represents the outpatient. The outpatient in 2020, as you can see, is lower than the other years prior and then in 2021. However, I wanted to mention that for outpatient services, telehealth was really big in 2020, and the cost of telehealth is lower than, you know, an inpatient visit. So therefore, you know, this may not be a full representation of the utilization. And then on the
just to clarify for maybe some of the new committee members or folks in the audience, PMPM is just per member per month, and it's kind of an abbreviation we use in the cost and budgeting. And so if I'm interpreting this right, Sapari, and tell me if I'm wrong, on the far right, that's saying that for January 21 to December 21, we spent $96.69 on inpatient per member per month, $258.93 for outpatient, and then $60.56 for pharmacy on a monthly basis. And it's per member, not per employee.
Absolutely.
Okay.
Did you want to join Kaiser Permanente, Brian?
Well, that's a loaded question in front of a lively audience.
Perfect. That was a perfect explanation.
Just for people who aren't familiar with it, when you're using dollars PMPM, changes in that can either reflect decreased services per 1,000 members, you're using less care, less office visits, or it can reflect decreased costs per visit. And the converse is true as well. So we know for 2020, there was some decreased outpatient utilization, some things like elective joint replacements and other elective surgeries may have been deferred or delayed. And so that makes sense to a certain extent. Inpatients, there is some COVID utilization in there. And we saw with PEB somewhere between 5 and 13 members hospitalized during any given month. And that pretty much correlated with the statewide epidemiologic trends related to hospitalization and the surges. But despite that, the number really actually went down a little bit compared to previous years. And the current inpatient utilization costs aren't really any different than they were back in 2017 or 2018.
Thank you. Any questions here? And this next slide, what we really wanted to show you is that the engagement level in your population, studies show that the more engaged members are, the better patient experience they will have and the better outcomes they will have. So just to walk you through this slide, we are reflecting data for the PEB population for Q4 through Q4 of 2019, so pre-pandemic number, and that's in kind of the lighter orange color on the top. The second, the orange color is through Q4 of 2020, and then the darker orange color is through Q4 2021. And what we're measuring here, again, from an engagement perspective, all of these categories looks at, again, how often, how engaged our PEB members are with our system. So under getting connected, you can see that 2019, they were at 82.8% connected, meaning that, and this category measures their engagement with our website, with kp.org. During the pandemic, the orange color, they were at 84.7%, so slightly more engaged during the pandemic. And then in 2021, as you can see, it has increased to 90.6% engagement. So lots of members going on to our website to do various things, which we will talk about later. And again, that's compared to the regional average here, Kaiser Permanente book of business in the Northwest, much higher because we're only at 78.7%. And then the industry average reflects for all of our Kaiser regions, industry meaning that we're looking at PEB as compared to other like industries in our other Kaiser regions. So PEB is considered a public sector account. So that's what we're comparing it to. Knowing your numbers. So this is PEB members understanding what their BMI, blood pressure, their exercise levels are, and that slightly has decreased from 2019 to 2021. Staying up to date, meaning that they're going in and getting their screenings, their cancer screenings, they're getting their flu shots, they're getting their glucose measured, and that has been pretty stable from 2019 to 2021. Seeking care it reflects members coming into our office and getting care from inpatient visits, and also calling the nurse advice lines and using emails to connect with our clinicians. And that has increased slightly from 2019 to 2021. So again, the purpose intent is kind of to show you that engagement overall for our PEB member population has remained fairly consistent pre and new normal pandemic. Any questions here?
Yeah, it's a nice kind of consistent story here. PEB members are highly engaged. They seek appropriate care. They stay up to date with their preventive services things. During the pandemic, they didn't know their numbers as well. They came in to see us in the office less, which is where we measure weight and we measure blood pressure. So that did go down. So it's and they use electronic engagement with our website very appropriately and well, much higher than our regional average. So it's kind of a consistent story. It's what we really know about our PEB members. Many are long-time Kaiser Permanente members. They do tend to get a lot of health care. They do have some health risk. They have PCPs. They know how to use the system. They're using the system really optimally in certain ways. And it also looks like some of the barriers you might see aren't present, like people that had high deductible plans will come in a lot less. So that's what we think is important data. We know it's not the usual data that gets shared around groups, but we think it's important. It really gives us some insight into how the group is behaving in the healthcare world, which really does have impact on their management of chronic conditions, overall satisfaction with care, and disease detection.
Is there any sense of for the percentage of PEP folks who aren't engaged, who they are and what the reasons are, what the impediments are? Is that something that you'll maybe speak to a little bit later on?
Yeah, let's look at the next slide, and I'm not sure we answered the question, but we certainly looked at a few things on the next slide.
Yeah, and for this slide, and my apologies that my screen is very small, so I'm going to move this to my other screen so I can kind of talk you through this. And so forgive me if I'm not looking at you. So this slide here talks about the health engagement. So the categories that we just talked about, what we're doing was we're kind of blowing up a couple of them just to highlight to you what it is that we look at and how do we look at it. This helps guides us as to where are the gaps and where can we address those things that are falling behind. So just to orient you to this table here, the top part is your demographics. So we break it out by gender, by age, by race, ethnicity, and language spoken, and then how long they've been with Kaiser Permanente. So for PEB, if you look under we'll just kind of highlight the race ethnicity category. For PEB, your group is PEB. You have 7.3% of your population is Asian, 4.2% of your population is Black, 11.2% is Latino, and 72.9% is white. The other category is kind of a smaller subset, and this includes members who did not indicate what their race ethnicity was. It also includes American Indian and those who could be multiracial. Does that make sense? Perfect. And so when you look at the buckets that we were looking at in the prior slide, we pulled down the seeking care. Again, these are the individuals who are going in for services, are calling our advice nurse, just reaching out for that care piece. And as you can see, when we look at race and ethnicity by the different populations, it's fairly similar all around. So Asians at 94%, Black at 92.6, 92.5 for Latino, and 93.6 for our white population.
So Pari, I see Emily has a question.
Thanks, Emily. And Dr. Bachman, I don't know if you saw that question. I think it's a smaller population set, not enough members to be statistically valid.
I'm not sure what
Oh, Emily's question is, why is American Indian in the other category?
I think it's that reason. It's a very small number. I mean, this is just a national way that our data experts made some conscious decisions how to do that. It could, if it's enough and it's valid, it can be pulled out separately.
Mm-hmm.
But thank you. That's a great question.
Yeah, excellent question, Emily. Thank you.
Yeah, I would just add that actually in Oregon, we have a law that, and I don't know how familiar everyone is here with that law, but for Oregon Health Authority and Oregon Department of Human Services, there's a law that is looking at developing uniform standards for the collection of race, ethnicity, preferred language, and disability status data. So the Real D. So I don't know if there's a way to begin to align with what those two state agencies are doing.
Yeah, so this is not Real D data. That's in its infancy in terms of collections. The numbers are really fairly low of collection across the population. But yeah, that would certainly be an ideal future state to have that broken out in the more complex categorization used in the Real D. So yeah, that's a great place to be moving towards.
Okay, yes, and then
this is self-identified data. So.
Yes, okay, yeah,
That's
and especially I think a movement towards identifying the members of the 9 federally recognized tribes too in Oregon. even though we have lots of tribes represented in the state, just because of that sovereign nation status, government to government relationship that is required with the 9 federally recognized tribes in Oregon and the state governments. Thanks.
We will need some education on that. Other people in Kaiser Permanente may know, but we do not. So we'll have to let's work that with you to understand it better. Thank you.
Okay, yes, I can definitely connect you with our tribal director, Julie Johnson at Oregon Health Authority. And then also there's her counterpart at ODHS, but we can start with Julie Johnson.
And just to respond to Brian's question, you do see some significant variation here by age, and that's not too surprising. People who are younger are less likely to be accessing care because of general better health status, and that's just what we know. So you can see that's the staying up to date in the 18 to 30-year-olds is much lower than the 51 plus. And the other big variation is organizational tenure, and you can see sort of as people have been getting their care through Kaiser for more than a year, they're much more likely to have been engaged. And that's based on time and sometimes based on for staying up to date in preventive services. People have recently had the preventive services and actually don't need it until after they've been with us for more than a few years.
Dr. Bachman, in the last category, staying up to date, or the category that we pulled out, again, kind of a similar story in that it's really even across the board with respect to members, making sure that they're coming in to get their screenings and flu shots and so on and so forth.
And that's what we want to see. We really obviously don't want to see those health disparities based on either race, ethnicity, or language. And just as we'll talk about it, lots of our work, which is hard to encapsulate in a short conversation, really is finding where there's variation there and then sort of tailoring programs or planning specific outreach to segments or groups or geographies that are lagging compared to others.
Any additional questions here? And thank you, Kelly, for including the Real D links.
So this is some data on where we have the privilege, I guess, of understanding our members and our patients' health behaviors in a way that, in an organized and systematic way, and we can track this over time. These are two of the variables that are important. On the right is smoking, the left is exercise. About once a year, we ask people when they come into clinic primarily, do you exercise? If yes, how many minutes in a day or in a week to do that? And we know the ideal state, or the Surgeon General recommends 150 minutes a week or more of daily exercise. And you can see that, that's the upper left graph there. And that number was 34 and 35% in 2019 and 2020, and then went down in 2020 and 21 down to 29 to 31%. And so that may be a COVID factor related to changes in lifestyle due to exercise. And then you can see the converse of that on the lower bar graph there is an increased sedentariness, which is less than 30 minutes a week of physical activity, going from 46% in 2018 up to 53% in 2020. So that's a concern. Certainly, lack of physical activity or being sedentary increases metabolic risk, increases the tendency towards weight gain, increases the likelihood of mental health problems, and so on. So it's really almost anything we look at is likely to be exacerbated or a health risk when people are not as physical active as they could be. Now, there are some people who PEB members who have very physical jobs and are always moving. Not quite sure how reliable this data is. Then we match this self-reported lifestyle exercise data to kind of other epidemiology studies and other ways that's been collected. We see our data fairly consistent with that. So we do think it's not perfect, but we do think we are measuring something. In the office, we use that as kind of a springboard for conversation, whether somebody's seeing me for a musculoskeletal problem or for a diabetes concern or for an anxiety concern, we can certainly link in their current physical activity state, acknowledging that if they are more physically active, they're more likely to improve their health management of that. Then we can link to other resources, whether it's online resources and physical activity classes or individualized virtual health coaching. On the right side of that is smoking. And you can see that really the smoking rate, and this is tobacco use, which includes cigarettes, pipes, oral tobacco, has gone down from 10% down to 8.5%. This is consistent with their book of business. It's consistent with trends. We know there's been more substance use during COVID, so it's good to see that people are not using more tobacco. We know just the sales of alcohol are up, and we know alcohol-related ER visits are up, but we're not seeing that with smoking. This doesn't measure vaping. This doesn't measure nicotine use via patch, gum, or e-cigarettes, but the question asked specifically around tobacco. And you can see that PEB members are really significantly less likely to use tobacco than our regional average, 11.6 versus 8.5 per 6. Not on this slide is data around BMI and obesity rates. And I will say that with a little bit of a caveat, because the percent of PEB members that were measured in 2020 was 69% typical utilization. In the office in 2019, in 2020 and 21, that went down to 56% because there is more virtual care being done, and we don't record the self-reported weights in the same way. PEB has over time has had an average higher BMI or higher body weight than our book of business, which is 44%, have a measured BMI greater than 30. In PEB 2 years ago, it was 48%, and that's gone up to 50% in 2021. I think it's a real finding when we look at members with PEB members with BMIs more than 35 and more than 40. We're also seeing similarly impactful weight gain. So currently 14.4% of PEB members have a BMI greater than 40, which is more than 100 pounds over the healthiest weight. And when you get to that level, there's typically 3 out of 4 people do have health issues related to body weight. So that's significant. I was trying to find reliable data around, there's just all this sort of lay discussion of COVID-related increased body weight. And I saw 2 camps. Certainly lots of people are reporting that. I also saw one analysis that really compared weight change over time in the United States, and they weren't, which is going up over the last 10 years, or last 20 years really. And it wasn't clear that the increased body weight in 2021 compared to 2017 was really that much different than the progression in elevated body weights that have been seen over time. So certainly for an individual doing counseling, it's a great time to take stock in somebody's health behaviors, whether that's exercise, whether that's diet, whether that's sleep, or whether that's weight, since we know the pandemic has affected people in lots of complicated ways. Any questions?
There is one in the chat, Dr. Bachman, from Emily. She asked if we have any future plans to measure the vaping rates, which is increasing dramatically, especially in the younger population.
Yeah, it is measured but not reportable in pediatrics, and I do think we need to get better at that. I haven't heard of any specific plans. It gets to be a complicated question to ask because nicotine, it really should be, do you use tobacco? Yes, no. If so, how? Do you use nicotine? If yes, no. If so, how? Do you use marijuana, et cetera? But we certainly on the radar, hasn't been prioritized, particularly with everything else going on in the last couple of years.
Thank you.
Yeah, we can go to the next slide, please. I can't see the chat from my technology today, so please.
Yeah, I will let you know. I'll monitor.
Yeah.
And just a time check, and Brian, you can help us too. I know that we have maybe 11 more minutes left. So do you want
Holy
us
moly,
to?
I'll speed up.
Do
Okay.
you want us to try to wrap it up, Brian, or can we take it a little bit longer?
I think you could take a little bit longer. Stephen, what do you think? I mean, I think we're scheduled to get until 4. We're going to try to wrap by 3 to be respectful of the committee members' time, but we can go over. My sense is if you need to use an extra few minutes to finish it, that should be fine.
Yep, I agree.
Okay.
Diabetes rates were stable. This is very narrow. HEDIS definition is very strict. Concerned with increased weight gain and increased increased weight gain and decreased activity, that diabetes rates will go up. That's certainly a concern. I know that's come up at the PEB meeting, the last meeting. Depression rates, not surprisingly, did go up from 7.3% to 8.1% between 2020 and 2021. So those are problems. Asthma rates pretty much stable. Next slide. This is looking at some preventive services metrics, and we do see some variation, say for flu shots. You can see the highlight there, higher rates of flu shot use in Asian population compared to other populations. You can see for breast cancer screening, you can see the highest rates in Asian, Black, and Latino women with lower rates in white women. Cervical cancer screening, highest rates in Latina women, but pretty high rates overall in the population. In the colorectal cancer screening, we see higher levels of screening among Asian and Black individuals.
Are there any, do you guys have any sense, even outside of the data, like anecdotal evidence or stories that may illustrate, you know, why some of the disparities and differences exist?
Some of it relates to patterns of healthcare utilization. Some of it I do think is cultural. I think there are some cultural barriers. We know that we've been challenged with colorectal cancer screening in Latino men. And so if you broke that statistic up between men and women, you would see much lower rates in men than women. And we have had some success in sort of smaller pilots in sort of culturally specific outreach and navigation and education around the importance of colorectal cancer screening. And when done specifically, that was successful.
Because I'm wondering whether at a future meeting it would be valuable to share some of that more detailed information with the committees for further discussion. Just a thought, just a proposal.
Yeah, we can do that. I mean, there's whole complicated sort of work plans around this, and we know some of these numbers have gone down a little bit during COVID, so it's really redoubling our efforts to do that. And we do think that there are cultural impacts, and so really using that in the outreach is important.
And for PMAC and coordinating council members, you know, if anything interests you or if you have questions, again, please don't hesitate to speak up.
Yeah, and actually there's Emily made a comment. She asked if does Kaiser have the ability to disaggregate Asian cervical cancer rates to ethnic groups like Vietnamese, which is generally known to have highest cervical rates for all racial ethnic groups?
I do not believe we could do that easily.
Thank you.
But that, which wouldn't stop us from doing more outreach, though. So there's an issue there. This is just kind of the pattern over time, and the news is that there have been decreases, though the numbers aren't necessarily a whole lot lower. The numbers are lower than they were 2 years ago, but they're still, if you compare to national statistics from 2019, in general, PEB members are still attained at very high HEDIS levels above the 75th or 90th percentile if you're using the 2019 standard as a benchmark. So you can see the dip and things like, you can see the dip across the board, but the numbers were really quite high to start out with when compared to national benchmarks. Next slide. And this is just indicating mental health utilization. And on the left is outpatient visits for behavioral health, on the specifically mental health. And you can see that those numbers have really increased. And we looked at this across all subpopulations that we looked at. We saw that the numbers were up, age, gender, race, and ethnicity. On the right, it's a much lower number per thousand, but you can see substance abuse outpatient visits have also gone up. So it doesn't mean, it just means there's more care being delivered. It doesn't mean we aren't necessarily keeping up with the demand that we're seeing. So just a whole bunch of stuff. I mean, there isn't one message. We are really just, we acknowledge that some of the numbers aren't what we want to see, or not at the high standard that we expect for ourselves. We know there's reasons for it, both member reluctance to come in for certain services, both us redeploying staff in certain situations away from their usual outreach that they were doing towards things like doing COVID screening, COVID vaccination. But we're sort of back in the game, and I think are really doing it more than ever before with the health equity lens and looking at that data as we develop our strategies, adding FTE where we need to in primary care, in mental health, and then just really focusing on getting people back to care. And where people are reluctant to get care, that's a time to really do personal outreach. With that, I will turn it over to Amber.
So this slide is in response to question 2, which was asking what services in the wellness space do we provide to our members, and then what services are available to PEB members only. So we condensed it all into one slide, and I'll go through each of them at a high level overview. And obviously, of course, if you have any questions, please interrupt. So starting with the total health assessment, or also the THA,
There is one question. I apologize. Mary asked centralized quality care team. Can you explain what that is? And I believe that might have been from the last slide.
Yeah. So with the move to virtual, with the change, with some more care than before going on virtually, and some we thought wasn't an optimal performance, there was bringing, rather than having all of the outreach being done in the medical offices by the medical assistants, wasn't working very well as people were coming back from COVID with the intensity of care needed in the medical offices and some staffing challenges. So there was more hiring going on for sort of experts, quality, prevention services, outreach staff. And that's what that is.
And apologies, if I could just mention or call out one more thing on this slide, using our RNs to support cervical cancer screenings and Pap tests is something that we're going to launch to help expand the appointment availability for our members. In addition to that, when members are coming in, that's when we have their attention. So if we notice that they have a care gap for mammograms or what have you, we are trying to have appointment availability during that day to help close those gaps while they're in the office, while they are attentive to their care needs. So sorry.
And this is Stephen. I'm just going to jump in here for a second to not only do the time check, but just to encourage that we love the questions and keep them coming. We do want to give all the carriers adequate time to present their services. And I think we really want to get to what are the programs that you have in place right now. And I know Amber's about to tell us that. And that even more important question, what can we as PMAC, PEB, the council do to help promote specific services more effectively? So if you can focus on those few things, and maybe let's target 155 to 157 or 58 to close. If that's okay.
Sounds great.
Good.
I will try and make up some time here. So the total health assessment is available to all members who are 18 and over and are registered on kp.org, and it's an online health risk assessment in which participants examine the areas that are affecting their overall health and helps them prioritize some lifestyle changes. In the self-help category, we have a few newer apps that have been available over the last couple of years. So Calm is really an app that is focused on mindfulness, meditation, and improving sleep. And it helps members that utilize it develop self-care tools. It offers 10-minute daily meditation, guided meditation. There's music to help support, calming anxiety and covering areas like stress, sleep, and gratitude. My Strength is more of a digital behavior app. So it offers members a personalized program to help improve their awareness and help specifically change behaviors. The app can help users set goals and help them work towards them and focus on things specifically in the mental health realm. So things like depression, stress management, parenting, pregnancy, drug dependencies, and then there's been a newer release for responders in modules in that arena, knowing the stress that they can come into contact with based on the nature of their work. ClassPass is a fitness program application that's offered also at no cost, and it gives members access to, I believe, over 4,000 on-demand videos or audio classes. And they also have the ability to utilize different gyms at multiple locations and just on-demand exercise classes. And kind of hot off the press, which we don't have a ton of information about, but another app in the mental health space that we're going to be partnering with later this year, and it's currently being piloted in our Colorado region, but is an app called Ginger. And so it's a digital mental health care company that provides a text-based emotional support coaching service. And so members can easily access private one-on-one texting to help meet their unique needs. And it really helps building different skills. There's check-ins and progress for them as they go through the journey. So we're hoping that will be available to the Northwest later in 22, but more to come on that. For health coaching, that is where a member works with a health coach who provides them personal guidance and help them participate and achieve their personalized wellness goals. And they can check in with their coach as often or as infrequent as they like to help them stay on track. We also have online healthy lifestyle programs, and they're also known as missions. So once a member completes a total health assessment, there are programs that populate at the end of them based on their answers and areas that they completed within the THA. And so based on what a member would select, it will help them with advice, encourage them, and give them tips kind of along the way to work on specific behaviors that they may have interest in changing. We also have a variety of videos and podcasts and recipes. A lot of our videos and podcasts are focused around meditation. So people can click those. Those are available to anyone. You don't have to log in to utilize them. And so people can kind of listen to them on the go or stream them while they are at their computer. We also have our health education classes, which are ran by registered dietitians and health coaches, as well as certified diabetes instructors and educators. And there's a variety of different classes focusing on tobacco cessation, weight management, new parents, pre-diabetes, diabetes, and so on. And people can register and sign up for those classes, again, at no cost. We also have our partnership with CHP Active and Healthy, as well as Choose Healthy. So CHP Active and Healthy is around discounted access to local gyms and recreational centers. It also can give folks availability to have reduced price for tickets and various memberships for different things in different arenas. And Choose Healthy is really more for kind of the fitness realm. So it helps provides discounts to, different fitness equipment. It also helps with reducing cost in kind of specialty care, things like massage and acupuncture and chiropractic, excuse me. And then in the column that is exclusive to PEB members, which again, I would assume most of you are familiar with, but just in case, I'll kind of give a high level overview of that. So Almada is a CDC certified pre-diabetes digital program that is coupled with coaching and peer support, also comes with an automated scale and has a bunch of different scientific metrics to help measure and help individuals along their way, specifically in reducing chronic conditions and hopefully preventing them from getting diabetes. And Weight Watchers, again, is something that's pretty well known, but, essentially a calorie counting system with various peer-based support and gives people a personalized program based on their age, weight, height, gender, so on and so forth. And WebMD is a newer kind of revamp or relaunch for 22. But it is essentially a platform that houses a ton of resources and can help personalize those resources based on the interest of the individual, and helps them track goals, track progress, and hopefully keep them motivated along the way. I think next slide.
Perfect. I'll keep this very high level. What we're hoping to highlight here is that in addition to the programs and resources that Amber shared, we also have a strong base within our care model to support the members' physical health. And so those are all of the different programs, and I'll let you review that on your own time because I know we're trying to make up time here. Next slide. Perfect. And these are just some of the new, again, our newer initiatives that we have launched late last year and into this year. Just briefly, our Get Care Now is really our on-demand video and phone visits with a clinician. So essentially, it's our urgent virtual care service, which provides 24-hour access to our Kaiser Permanente physicians through your tablet, smartphone, computer. And Chat with a Clinician is offered to patients when they attempt an e-visit and their condition directs them to seek other options due to the nature of their symptoms. Chat enables patients to ask questions about their symptoms and get care or get the next steps for care. The increased digital engagement was launched to support our patients before, during, and after their appointment. So for example, we send our patients or our members 48 hours in advance a reminder that their appointment is upcoming. While they're in their office, as I mentioned before, any care gaps, we remind them to try to take care of that while they're in the office. And then we also do post-appointment reminders, such as picking up their prescriptions on their way out of the clinic. Our outpatient pharmacy language translation. So beginning late last year, our outpatient pharmacies have the ability to offer prescription labels and drug information sheets in 14 additional language, not including English. So that definitely has helped to bridge the gap for some of the health equity issues we have. Chat with a Nurse is launching in late Q3 of this year, and which will provide members 24/7 access to our nurses for advice. And then lastly, our late sequela clinic. We launched this new clinic to support members experiencing prolonged symptoms of COVID-19. So according to the CDC, about 10 to 30% of COVID patients will experience prolonged symptoms, and it can vary from person to person with respect to the severity level. Our medical teams reviewed hundreds of COVID-19 cases to identify patterns and symptoms. And with this learning, they have been able to develop a panel of orders to support our clinicians at every level to evaluate the symptoms and provide treatment. Okay, next slide.
So this kind of rounds it out with question 4. And so looking at ways that we can partner and support and promote programs for all carriers and for your population. So knowing that this meeting is a part of that and what's creating this, also some of this is kind of on the heels of completing the recent Hero Scorecard, which a little teaser that will be coming at a future date that I've had the pleasure of partnering with Teresa and Stephen on and some other stakeholders here. So part of it is creating some sort of formal strategic plan or map or outline, whatever you would like to call it, but something that really gives direction and clarity on where you want to go with the programming and the areas of which you want to focus. The other thing that we recommend that's also been talked about at a couple of board meetings is looking for one consolidated wellness platform to be kind of the one-stop shop for all of the wellness resources and offerings, so people know exactly where to go instead of, kind of piecemealing and looking at a variety of different areas. The piece around the communication strategy is a really important one. So looking at ways to communicate through a variety of different channels, knowing face-to-face is usually the richest area to present those types of communications, but we've had to make a lot of adjustments in COVID. Hopefully we'll slowly be getting back to a little bit more face-to-face, but in the interim, it's things like, video visits, team meetings, team chat channels, instant messaging, phone calls, social platforms where appropriate, live chats, one-on-one, so on and so forth. Just looking for as many different opportunities to share one consistent message across a lot of different channels. We all know that everybody learns and receives information differently, so providing different modalities can be really helpful in that space, especially based on individual job responsibility. Not everybody has access to email. And just really securing and defining one message helps with repetition and retention. So even when someone hears something at one point and it's not necessarily the right time, right place, they're more likely to remember it at a later date when it is more applicable for them. And rounding out, this is kind of a sub-bullet to the communication piece, but looking for ways to kind of create simple one-pagers that houses all of the resources that are available under one topic, like mental health or weight management, and having them in a really easily accessible way so multiple people can pull them if they're having, again, team meetings or hosting various webinars, that it's a way to continue to repeat those offerings and having them be able to clearly decipher what's available to them and what they may want to participate in.
And Amber, as I'm looking specifically at the second, third, and fourth check marks, I think I want to ask the committee and Kaiser and the other carriers whether for our next discussion, maybe we invite you back in May and have a discussion about ways we could target communications or how we want to communicate through different modalities. And I say that because next month we'll be gathering information about the member experience and their stories. And maybe we get back together in May and marry the two up and have some brainstorming about, ways that we could be more successful in, promoting or outreaching to specific members and engaging them, if that makes sense. Let me open up to the committee to get their thoughts, and also for the carriers, if that makes sense to you guys.
Yeah, I would. Yep, it makes sense to me too. And I was just wondering too, if there's any home visiting that's happening within the Kaiser and the other carriers network, because I've heard that that is one effective way to get to folks who may not have internet access or, that kind of thing. But yes, I like that idea.
Kaiser, any reaction to the home visits question?
Sorry. Yeah, sorry. I didn't know if you wanted to kind of move on. Yes, definitely. I know that it is happening. I'm not sure how frequently and what that looks like, Emily, but we can definitely come back. I know Dr. Bachman had to drop off, but we can definitely come back with that. The other thing I wanted to mention to Emily's question is that, when we are developing these models for access, I mean, we definitely understand, the broadband issues and the connection issues with respect to virtual care and things like that. So we definitely are making sure that we are meeting the members where they are. So texting is a form of access that members can definitely use that doesn't require as much broadband or any broadband. So again, we're trying to meet the members where they are.
Thanks very much to the Kaiser team. We appreciate all the information that you gave us, the work that you put into this to bring this to us. And as Brian suggested, we'd love to have you back and have more detailed conversations. For the sake of time, we're going to move on here. And just to set expectations for PMAC and council members, we wanted to set the right expectation about how long we might be here today. And if you looked at the original agenda, we did say somewhere around 3:15, and now it may be closer to 3:30, but because we do want to get the other carriers adequate time to share their services too. So we understand if you have to drop. By the way, this presentation and the other carriers' presentations were included in the meeting invitation. Rebecca sent them to all of us, so you'll have those for references.
And to that end, Stephen, let me also encourage people, because we're supposed to encourage stretching breaks, and I don't think we have the bandwidth to take a big break. So I want to encourage people to stretch as we listen to the presentations. If you're at home, walk around the living room, maybe do some crunches or push-ups. Anyway, so I encourage you to get up and stretch and stand up as we launch into the next presentation.
All right. Thanks, Brian. With that, we're going to welcome the Moda Health team to share their story. And thank you very much, Moda, for being here. And I'll turn it over to you.
Great. Well, thank you guys so much for having me. I'm really excited to talk about this topic and excited for the topics coming up too that Brian was talking about. So thank you for including us in this. I am going to go ahead and share my screen. Please let me know if you can see it. Oops, there you guys all are again.
We can.
All right, great. So I kind of took a well, actually, first let me introduce myself. My name is Erica Hedberg. I am the Director of Government Programs for Moda Health, and I have been working on the PEB account for almost 7 years now. Before I came to Moda, I was actually a state employee for about 10 years, working mostly with the Oregon Health Authority. And so I was a PEB member while I worked for the state, and was actually a PEB member prior to that because both of my parents worked for the state. So I have a lot of experience with PEB benefits and am very familiar with them. All right, and a little bit of a different approach to the presentation than Kaiser. I'm going to jump into our programs that we offer first, and also provide some utilization on those programs that I have. So our big program that we have at Moda Health for PEB members is called Moda 360. And this is a really unique program. It was implemented for PEB on 1/1/2021. We have another large government account that is also using the Moda 360 program, but really is limited to those two groups. And Moda 360 is a big program, and I'm going to try and attempt to explain it for everybody. It is a non-traditional approach to customer service, and some of the key components, one of the major components is that it is a technology console, and it allows one main source of data to support our members to help them navigate through the sometimes complex healthcare system. So prior to Moda 360, we had a lot of information about a member, but it was kind of dispersed throughout our organization and also with our vendors that we partner with. So with Moda 360, we took all of the data that we have on our member from all of our different departments within Moda and from our vendors that work with our members and put it into one place. And then on top of that data, we built a technology console that takes that data and makes actionable alerts and information for our navigators to be able to use to help the member. So for example, that console includes things such as care alerts, and those are mostly preventive measures that a member may not have filled. So for example, if a member has not had their annual wellness visit, if they haven't had a dentist visit within the last year, if a diabetic member has not had an A1C test, or if a member is not adherent to their medication, then those alerts show up for our health navigators, and then they can help members close those gaps in care when they're working with them. The console also includes all of the different programs that we have identified would be good for that specific member. And so for example, a navigator can see if we've invited a diabetic member into our Livongo program, which is a program, a diabetes management program. And it'll tell the navigator when we sent the invitation out to the member and if the member is engaged with that program. So those programs are really there so the navigator can connect members to the programs that can help them in their healthcare. In addition to connecting members to the right programs and closing gaps in care, our navigators also help members navigate through the healthcare system. So as we know, healthcare can be complicated. And before Moda 360, our customer service team is great, but a lot of times, members may call about a question. So let's say that a member had an issue getting a prescription for DME. And a lot of times it's because maybe the provider didn't submit the right information or all of the information needed. So before, our customer service rep would tell a member, yes, this is what we need, this is where we're at on it. But then the member was really left there to try and figure that out on their own. And most members don't do this every day, so they don't always know what the correct next step is. So with our health navigators under Moda 360, they actually take the member out of the middle of that situation and will reach out to the provider themselves and work with the provider as well as the DME provider or Moda or whoever that needs to be. But they're the ones who work to connect all of the dots and make sure that the member gets what they need. And the reason for that is because the Health Navigator, this is something that they actually do on a daily basis. And so they often know those next steps more than a member would know. So that's a high level overview of what the Moda 360 program is. And then on top of that technology platform, we offer a lot of different programs and vendors and point solutions. Before I get into there, I just wanted to point out that we have received a lot of really great feedback from members since launching this program last year. And so I included some comments here, and just due to time, I'll let you guys kind of go through and read those. But a lot of members talking about the help that they're getting in navigating the healthcare system.
It may be a little, since you're not in the slideshow, it may be a little, the font may be a little small for folks to read.
Thank you.
Or I'm showing my age.
Sorry, no. And you know, Brian, I should have used the PowerPoint slide instead of the PDF. That was a bad decision on my part.
No, it's all good.
This might be a little bit better, but we're getting feedback like this from members all of the time, and I just took 4 comments in here. All right, so now I'm going to talk about the programs that are involved in the Moda 360 program. And the first one is CirrusMD, and this was implemented 1/1/2021 for PEP members. And it is a text-first telehealth app that provides access to a provider 24/7 and nationwide. And there's no member cost share either. And one thing that I like a lot about Cirrus is that the providers can write prescriptions. So I always point this out, but when my kids were smaller, they're not so small anymore, but when they were smaller, they would just get pink eye every once in a while. And anybody who's had small kids knows that you know what pink eye looks like when they have it. It's very easy to identify it. But if you don't call early enough in the morning to get that same day appointment, you may be told that you need to wait till the next day to schedule an appointment. And we all know what it's like to have a kid who has pink eye. And if you wait till the next day, it can spread, it just gets worse, and it's just not ideal. So with Cirrus, what you can do is you just start a chat with the provider. If they respond back within a minute and you just text back and forth, that chat can be elevated to a voice call or to a video call, so the provider can see your child's eye and then can prescribe a prescription that you can go and pick up that day. I recently used this for my daughter when she unfortunately had COVID, and she had a really high fever. And so I just picked up the app, started chatting, and really within a few minutes, the provider had told me that she was okay, that as long as she was acting fine, it was okay, and just to keep an eye on it. So it saved me a trip to the urgent care, which was nice, and it was extremely convenient and no cost. So here is the PEP utilization we have seen on this, and I can't show pre-pandemic because this program was implemented in the middle of the pandemic. But we have seen some utilization and engagement with Cirrus, but would definitely like to see more. We try and promote this program in several different ways, and one of those is that we will send emails and actual letters to our members, letting them know. So anytime you see a spike here, it's usually because we've sent an email or a mailing to members. We have a email communication going out right now that'll be rolled out to PEP members here over the next few weeks. And that email that they'll receive has a link that they can just click on, and it'll allow them to register for Cirrus. So excited about that going out. And then in addition to that, those programs that I had told you about that show up in the console that our navigators are using, those will actually start appearing in our member dashboard here at the end of this year. So when members log into their dashboard, it'll show them the 3 top programs that we have identified would be the best fit for that member or could help members manage their care. So for example, Cirrus might show up for a member who has had recent ED visits, or it might show up for members who don't have a PCP established. And that would be something that is recommended for them. All right, the next program I briefly spoke about is called Livongo, and it's a diabetes management program that we implemented 1/1/2021. And it combines advanced technology with coaching to support members with their diabetes. And this also has no cost to members. So the program includes a smart meter that is sent to members. And so when members have their blood sugar read, that reading goes directly to Livongo. And then after a reading, they get instant feedback from Livongo. So for example, if someone's blood sugar was a little low, then the reminder that the alert that comes back might be a suggestion on how you can raise your blood sugar if you drink a little bit of orange juice. However, if a reading is outside of a range that's identified, then it'll actually send an alert to that member and anybody else that that member has identified to receive alerts. So that can be their PCP or any of their family members. And then they'll also get a call from a Livongo person as well. The program also includes free unlimited strips and lancets that are shipped directly to the member, and the member can order those directly from their smart meter or through the app. And then the program also includes coaching with certified diabetes educators that are available anytime via phone, text, or the mobile app. So we've seen some good engagement with the program. Right now we have we have about 16% of the eligible population engaged with Livongo. And that's a little bit lower than some of our other groups. And I think that that's because PEB fortunately has such a great benefit for diabetics where all of their testing supplies are already covered at 100%. So I think that there's just not as much incentive for PEB members to engage with this program as there might be for members on other groups. But the members who are engaged with the program are engaging with the app and with the diabetes educators. And here you can see some clinical outcomes for the program for that first year. And you can see that 72% of members who are engaged had the blood glucose checks in the normal range in the last 90 days. And Livongo also estimates that the change in estimated HbA1cs for starting uncontrolled at negative 0.91%. So really helping to manage those sugar levels. All right, let me know if you have any questions about these programs as I go through. Another exciting program that we implemented, and we implemented this a little off renewal. We implemented this 7/1 of 2021, and it's called Sempre Health. So Sempre, for members who take certain preferred cardiovascular and diabetes medications, the goal of the Sempre program is to help with adherence to those medications. So when members sign up for the program, Sempre will send them alerts reminding them to fill those prescriptions. And those alerts are through text messaging. And so the member can respond back to that text. And then if they do, then Sempre can actually have the prescription filled at the pharmacy. So all the member has to do is go and pick it up. And when they do go and pick it up, they get a discount off of their cost sharing for those drugs. And the more that the member adheres to that medication and fills it, the larger that discount becomes.
And Erica,
so
going back to the previous slide on, was it Livongo? Question, is that a program, even though PEP has great benefits, is that still a program that MODA would like to see increased utilization in? Do you think more members would benefit from enrolling in Livongo? And if the answer is yes, and it looks like it is, do you think it would be valuable at a later meeting to brainstorm with the committees about maybe present how you outreach, how you promote these sorts of things, and start, working with the committees to figure out, are there other avenues or better strategies to get some of the members that aren't engaged for various reasons?
Yes, I do think that would be extremely valuable, because that's something that, as I go through all of these programs, that's always the key. And that's one of the biggest goals with our MODA 360 program, is not only increasing engagement, but increasing engagement in the right programs. So it's really, as I'll get to in some slides, it's really about using all of the information that we have about members to meet them where they are, and also to get them connected to the right programs.
Yeah, and even, I would even say even the promotional and outreach efforts. My main concern is if we keep outreaching the way we've always outreached, we're just going to get the same results. And so I think that's where PMAC, the coordinating council, with the carriers, maybe in the short term, can maybe think of some ways that would capture more members or speak to members more directly. Anyways,
to speak to members more directly, that's a really good point, Brian, and to have them pay attention, because I think that's one of the challenges when your members are probably, well, I know they have a lot of stuff coming at them all day. You know, we all do. And so being able to somehow filter, you know, get something to get their attention, to know that it's important or maybe valuable to the member. That I think that's a great idea, Brian. That's a really great question. So a question just popped up. I saw it says, has MODA asked their members how they want to be contacted? We are starting to do that. Yes, we had a little bit of a test into that. So when our PEP members took the health assessment this last year for the health engagement model, one of the questions in there is if members would like to be contacted by a health coach. And it was really great and kind of crazy this year. We had so many members respond that they wanted to be contacted by a health coach, and a lot more members than we had had any other previous year or from any other group. So what we did is we put together a little survey that we emailed to members to ask them how they wanted to be contacted and when would be a good time to contact them. Because one thing we've learned is if you just try to outreach to members through a phone call, it can be very difficult to connect with members because members work during the day or they can be busy. And so we sent out that survey. We had the majority of members respond back to the survey with their preferred method of communication and at what time of day would be the most convenient for them. So we're actually taking those learnings, and that's something that we will also be reaching out to our PEP members to ask them and to keep that information stored so that we can try and communicate with them through their preferred way as much as possible. I know that some people would like to be contacted by text messaging, and that's something that we're looking into. There's a lot of, I don't want to say, oh, good, Cash or Teresa, that's great. That's great to hear. Providence saw that too, but very interesting. But the text messaging can be a little bit tricky. So we're just trying, right now we're in the stages of looking into all the legal ramifications with text messaging, but that is definitely where we would like to head to next.
For example, and this is just something I think for all the carriers to think about, and I'm sure you already are, but one thing we've talked about in previous meetings is, you know, for example, we lean so much on, you know, written and electronic communications that what do we do for our members who are visually impaired, or members who frankly, maybe just a person-to-person conversation is the best way to outreach. And how do we identify those members and make sure that they're getting, you know, they feel like they're getting the same sort of, you know, service or outreach as anyone else. And again, obviously we're in the situation we are because no one's had the answers up to this point. So I don't mean to put you on the spot. I just kind of want to flag it for things for us to think about as we move forward.
Great, thank you, Brian. And just really quick to finish up Sempre, just in that, remember we just implemented it in July. So this is from July through the end of the year through December. And we were able to get 117 members enrolled, so 26% of the eligible population. But those members had a total savings of over $8,000 in that time frame. And the average savings per member fill was over $25. And as we starting to look at adherence, and we are seeing that 79% adhere to the medications for the members enrolled in the program compared to 49% of those who did not enroll. So really excited to see the utilization of this program as it continues. All right, Maru is another program that we implemented 1/1/2021. And this is a 12-week online program that addresses anxiety, depression, and burnout. So Maru sends wearable biofeedback to members in a little welcome kit. And then they use that to increase focus and manage stress. These exercises can be practiced anytime, anywhere, which makes it a lot more convenient. And then members also have access to a personal remote therapist via chat in the Maru app. And one of the people on our team actually went through the Maru program, and she told us that she thought it was a great program and that her therapist actually reached out to her quite a bit, especially when she wasn't doing her exercises when they were supposed to be done. So her therapist did reach out and just check to make sure everything's okay and if she had any questions. The cost to members for this program is the applicable cost sharing for behavioral health visits. And then after that initial evaluation, then the program is zero cost to members. Here's some utilization data on Veru so far. By the end of the year, there were 121 PEP members who completed the program. There were a lot more members who were actively engaged in the program during the year, but they hadn't finished by December. So they're not being counted in this number. This is just the number of members who actually finished by the end of the year. And of those members, 75 of them were treated to remission. So Meru does the PHQ-9 and the GAD-7 test, the GAD-7 test for members when they start the program and then as they make their way through the program. So as you can see, as members engaged in the program, the scores on those tests did drop for members. Another program that we have on PEB, and we've had on PEB since we started offering medical to PEB members back in 2015, is the Comprehensive Coordinated Care, or the C3 program. This is an invitation-only program that addresses chronic disease management. So it removes barriers to accessing care while incentivizing high-quality primary care providers by removing the cost share for those PCP 360 visits. So when a member is enrolled into the C3 program, their cost sharing for primary care is waived. And the reason for that is because this program is really aimed at identifying members who have chronic disease or a lot of different factors, or identifying those members who are just on the verge of starting to kind of spiral. And it looks like, as we look through our data, it looks like they might need some assistance. So we reach out and invite them into the program. It waives the cost sharing for those visits, so to encourage them to engage with their primary care provider so that they can help manage their care. And then we also give them, we assign them to a personal advocate. So that advocate works with them to coordinate their care. So a lot of the people in this program have more than one chronic disease or more than one thing going on. So for example, members could have a behavioral health issue that they're dealing with, as well as a chronic disease like diabetes or cancer. And so they may have a lot of different visits, doctor visits, or prescriptions that they're dealing with. So this advocate can really just help them navigate through that healthcare system. And it's one person, so they can reach out to that person anytime that they need some help.
Erica?
Yes.
Are the PCPs and the PCP 360, are they what are the characteristics of those providers?
Yeah, so a PCP 360 is really our term for a patient-centered primary care provider. With our PEB plan, members have to select a PCP 360 for our plan, and then they go to that provider and they really coordinate their care. But the qualification is that they are part of a patient-centered primary care home. And I'm assuming that everybody is familiar with that term, but raise your hand or holler if you're not, and I can take a little bit of a deep dive into that as well.
Yeah,
and essentially,
I would think most people don't. I would assume that most people don't really know what that means. And I think one thing that you could highlight, generally, my experience with patient-centered medical care is that the primary care provider is especially selected because of their quality and efficiency ratings. So that's really what I'm trying to get at here. This is ideally an enhanced experience for this patient and very patient-focused, correct?
Correct. So a patient-centered primary care home is a clinic that receives a certification through the Oregon Health Authority. And in order to receive that certification, they have to meet certain qualifications. So those qualifications could be, they have a behavioral health specialist on site. They offer 24/7 access. They have referring rights. There is a long list of quality measures. So it is essentially a high quality, efficient primary care provider. And we've done analysis at MODA, and there's been external research done on PCPCHs as well. And what we've identified is that members who engage with the PCPCH have lower costs overall. And Portland State University also did some research on PCPCHs that showed very similar outcomes. So yes, they are high quality providers, and members who engage with these providers can expect to have their care more closely coordinated.
Thank you for elaborating on that, Erica.
Yeah, thank you for asking. And with our C3 program, we have right now for PEB, we have 616 members who are actively enrolled in the program. And of those 616, 182 of them have a prevalence of a mental health diagnosis of anxiety and or depression. And so on the left, you can see the condition prevalence among our C3 PEB members. And the top one is anxiety, and then the third one is depression. And those are not single diagnoses. Most of the members in the program, as I mentioned, will have more than one condition in that they are experiencing. Right, another program is health coaching, and this is something that is offered at no cost to our members, and they can work one-on-one confidentially with a health coach, and the health coach helps them set goals, better understand their health and how to advocate for themselves, and also helps them to learn how to manage their health conditions like diabetes. The health coaching is done telephonically right now. We are with Moda 360, we are looking to enhance that experience and to looking to extend that communication to also video calls as well as texting. So that's something that I anticipate will be rolling out for PEB members later this year. Just an example of, or here's the utilization that we've had for PEB members. We had 241 sessions with health coaches this year for PEB members through these different programs: cardiac, depression, diabetes, spine and joint disease management, and well care. And like I mentioned before, we had a lot of interest from our health assessment this year. And so I anticipate that the numbers for 2022 will be larger than this as we were able to get those members engaged with our health coaching this year. Right, I'm going to talk about just a couple of programs that were implemented recently. So SWORD is a virtual physical therapy, and it was effective for PEB members 1/1/2022. This is a program designed for back, joint, and muscle pain and is at no cost to the member. This program, this program provides dedicated physical care specialist that designs programs that are right for the member. So when a member enrolls in this program, SWORD sends them out a kit that includes wearable technology. And then they also they meet with that physical therapist and they develop a plan for them. And the member then uses the technology, and that PT is watching the member as they engage throughout, the week. And they can make changes to their program as they go throughout the week. For SWORD, the way we have promoted it to members is that it's right now essentially an invite-only program. We identified members through claims data that we thought would benefit the most from the program, and we reached out to them individually. So you won't see SWORD advertised on our websites this year to just anybody, though anybody can enroll in the program. But for this first year, we just reached out directly to the people that we thought could benefit the most from the program. And so I don't have utilization data on that since it's just now getting started. Another program that we just implemented January of this year is called STRIVE, which is a chronic kidney disease management program. And this is also available to members at no cost. This program focuses on early identification and prediction of the onset of CKD and end-stage renal disease. And so this program really takes data, and they have algorithms that they use to identify members that they believe are in stage 3 of CKD. And then they reach out to those members and really help them identify early interventions to keep them from progressing into later stages of CKD. Another part of the program is that they try, when members do progress into the program or into the disease and need dialysis, then they try, when it's appropriate, to get members connected to home dialysis instead of going through a dialysis center. And there are a couple benefits to being able to do this. One of them is cost. The dialysis centers are extremely expensive. And another reason is convenience. Members who are on dialysis have to be taken by somebody to the dialysis centers, 3 or 4 times a week. And dialysis can take several hours, and it can also be very difficult. It can be very hard on somebody. So being able to do that in your home can be a very convenient thing for a lot of members. All right, so those are the programs that we are have implemented. I would just want to talk a little bit really quickly about health context. And health context to MODA is really our term for social determinants of health. So our MODA 360 platform really brings in data, all the data about the member. And one of our big focuses right now is being able to collect information on the member that is more than just their clinical diagnosis. So we can look at claims data about a member, which we have tons of, and we can identify the clinical patient. But what we can't see is everything else that makes up that member. For example, we can use claims data to identify diabetics, but to us, if that's all that we're looking at, to us, all of those diabetics look the same when we know, in fact, that they are not all the same. Some diabetics don't have a lot of support at home, so they may need more assistance with prescriptions or managing their doctor's appointments. Some diabetics may have transportation issues, so maybe they need some help in finding alternative ways to get to their provider visits. But there's just so much more that makes up a person than just their clinical diagnosis.
And Erica, I should interrupt you 1 second. There was a question for SWORD participants. Are those with MS and wheelchair bound able to access the program?
For SWORD?
Yes.
I believe so. And I can get some specific information from SWORD on that, and we can respond back. Have a follow-up with that.
This is Stephen. I'm somewhat familiar with the SWORD program, and I would say yes, because this is a virtual program. The sensors are sent to the individual at their home, wherever they live, and as long as they're able to apply those to their body, if they might need the assistance of a caregiver, but I would say that for the most part, somebody who was prescribed physical therapy wouldn't have been prescribed physical therapy if they didn't have the ability to move their limbs. So I would say for the most part, this is an accessible service.
Great. Thank you, Stephen.
And just a follow-up comment. This is Brian again. I'll probably just keep harping on this, but one thing this doesn't tell us, or what this is for people who have engaged. You were able to reach out and engage, right? And so one of the biggest challenges I think we have across all our medical plans is how do we reach the members who just haven't engaged up to this point for a variety of reasons?
Yep.
I think we're hopeful that, conversations with the committee and council and the carriers that we can, I think, hopefully share enough information with each other to come up with some additional, strategies that could find some PEB members engaging more than they have in the past. Again, obviously, we don't have the answer to this because this is something that's been hanging out there for a long time, but I do think it's something that we need to try to discuss, try to come up with potential solutions. And probably the next step, probably the first step going forward is just to get a better sense of why members don't engage. Because again, I think that's part of what we're doing with the coordinating council and all of this work is figuring out what's going on. We try to speak to our members, but there's things that we may not know about or realize that the more information we get, I think we may have a better chance to be successful.
Thank you, Brian. And the last slide on MODA 360 that I want to talk about is just continuing on health context. And one of the, in using our platform, it's really bringing in all of the data about the member and really using AI to identify the programs that we think could benefit the member the most and help them manage their health. And that's bringing in, so we can connect them to the right program of all of those ones I just talked about. And I also want to address one question. I forgot to do this when I started on the Real D data. Right now, we really don't have a lot of realty data on our members. We do get some data from PEB that they send to us on our eligibility file. But last legislative session, there was legislation passed that requires providers and health plans, that would be us, to collect realty and SOGI data on our members and then report that to the Oregon Health Authority. So that's something that we have already been working to implement so that we can collect that on our PEB members. And soon as those rules are implemented, then we will get that implemented into, especially into our member dashboard, and really work to try and collect that from all of our members. All right, so I want to talk really quick about a program that we are proposing for 2023 for PEB, and that's a behavioral health program. So to start that off, I just kind of want to talk about the need. And I think that we all can agree that, especially with the pandemic, it has really shined a bright light into our need to address access to behavioral health services for members. And what this slide shows is telehealth. So you can see in January 2020, right before the world completely changed and the pandemic hit, we really didn't have a lot of telehealth utilization. And if you look down here at the very bottom of my screen, you can see that. And then the pandemic hits and telehealth utilization skyrockets. These different colored lines show different types of service. So all of these types of service down here, they did increase from pre-pandemic levels and have stayed elevated, but have gone down a little bit. But members are still accessing all of these services through telehealth, just not at the same rate. This purple line is behavioral health services. So it just shot up, and it makes it look like all of the other services aren't even being utilized because it distorts the graph so much, because it is so much higher than the other services. And not only did it shoot up, but it has remained elevated ever since the pandemic started. So that tells us that there's a need for behavioral health, and that telehealth is also a solution that members seem to think is okay for accessing their behavioral health. So in response to that, it's really made us believe that we really need to address behavioral health and our members' ability to be able to access behavioral health. So we are proposing a coordinated care approach to behavioral health that addresses access, quality, and cost for PEB members. So I'm going to go to this slide, and there are a few different components to this program. The first component is what we call Moto 360 champions. So right now we have our health navigators that are part of Moto 360 that help members navigate the healthcare system. The Moto 360 champions are dedicated specifically to behavioral health. So they can help members find the right type of provider. They can help members find a provider that is accepting new patients, and then can also help them schedule appointments with those providers. One thing that we know is that members, when they go and have an appointment with a behavioral health provider, sometimes it's just not a good fit. And when that happens, a lot of times members just don't go back for another visit, and they just kind of stop. They just fall out at that point. With the Moto 360 champions, they'll be following up with members after their first visit with the providers to ensure that the provider was a good fit. And if it wasn't a good fit, then they can help the member find a different provider as well. Another component is specialty providers. So as we talked about all those different point solutions up above, we are bringing in point solutions specifically for behavioral health. So these will be telehealth providers so that members can access behavioral health providers and more of them, and it'll provide additional access to them. We're also bringing on niche providers, so providers that specialize in OCD, in eating disorders, and other niche services that they can help with their specific conditions. And then there's also the value-based payments that are part of the CCM. So right now we have value-based payments for our primary care providers. And so it really incentivizes providing quality care, and they get incentivized for that and receive additional payments. So we'll be expanding that to our behavioral health providers. And this is all built on top of a supporting infrastructure that has two different components. The first component is a decision support tool. So when we bring in this decision support tool, at first the Moto 360 champions will be using it, but then we will have it on our member dashboard. And so members will be able to use the decision support tool themselves. And what it does is it asks a series of questions, and it'll help identify the right type of provider that the member is looking for. And then after it identifies that right type of provider, it'll actually identify providers that are accepting new patients. And then it'll allow scheduling through the decision support tool. So members can access the champions to help them walk through that tool. And then, as soon as we get it put onto our member dashboard, members will be able to access that themselves. Another component to the infrastructure is an outcome management system. So we'll be supporting our providers and using an outcomes management system. And so right now, a lot of our providers are not using any system that's really looking at outcomes on their members. So this system, we're going to support our providers in being able to have access to this so that they can see the outcomes for their members. And we will also have this information as well. And the MODA 360 champions can utilize that information to help members find the right type of provider and ensure that it's a good fit. And I kind of described this member experience already, so in time I will go past that one.
And Erica, there are questions in the chat about.
Because I cannot see those, Alina.
Okay, so there's one where it says MODA 360 champion just for behavioral health navigation, healthcare staff only.
So the behavioral health champions are dedicated to behavioral health only. We do have our health navigators that can help a member navigate any situation, but the champions will be just for behavioral health.
And then another question is, are patients able to identify culturally specific providers and intersection with being transgender friendly, as one example, via MODA and other carriers too?
Yeah, so let me switch over to a different slide. And yes, they can. So we've just recently expanded our online provider search tool, Find Care. But even before that expansion, for behavioral health providers, we have been tracking that information on them for a while now. So we were able to know providers who are maybe their race and ethnicity, or if providers specialize in LGBTQ+, or a transgender, or any other specialties that they might have. So when a member's looking for a certain provider, then our behavioral health team would help them find that right provider. Now we have actually expanded our online provider tool to include that information. So right now,
Erica,
members, yeah.
So it's available online, but if a member just called for help, you guys have staff that would walk them through this and help them pick a provider based on those criteria?
Absolutely.
Okay.
Yes. Yes, absolutely. So online, or they can call in and we can help them find the correct provider. And I also just want to highlight on helping members find the right provider, which is the heading here on the slide. If a member does request a provider to meet their needs, then there are several different ways that we can work with them. And members can request providers for several different reasons. Maybe a member would like a provider of a certain race, or they want a provider that deals with a specific issue. So first, we'll help them look for an in-network provider who shares the member's background or the member's needs or requests. And then we can also make an exception to allow the member to see that provider at the in-network benefit level. So if a member reaches out to us and says, I really want to see this provider because I identify with them, then, and there are no providers in network that the member can identify, that fit that need, then we will make the exception to allow the member to see that provider. We also allow provider participation in our network. And we oftentimes, when members bring these providers to us, we will outreach to the provider to try and get them in our network as well. And then always the MODA 360 Health Navigators can assist members in locating the right provider for them, and can also assist in scheduling the appointment for them as well. And I'll finish on this last slide due to time. And I just want to say that provider diversity is a very big and important issue for us. And one of the great things about bringing in some of our vendors is it provides additional access to providers for our members. So especially, for provider or for members who live in more rural areas of the state where they don't have a lot of different providers to choose from. So having these national provider networks, virtual provider networks, allows members to have more access to providers of color or providers who specialize in the things that matter to that member. And as we bring these point solutions and vendors on, it's also very important that we look at their approach to diversity and to provider diversity. And this is just a high level overview of what our vendors do, but our digital point solutions provide members access to providers of color and or cultural preference, the rural areas, which I spoke to. And then all digital point solutions are developed and created to assist members with disabilities, such as hearing loss, vision loss, or limited English proficiency. And in the appendix, I just put slides that speak specifically to each of the vendors that I talked about, and some information on how they meet the diversity and the accessibility questions. And so I will just stop it there and see if anybody has any questions.
So one other question is, do you have the ratio of diverse providers per members?
Can you clarify the question? Who asked the question?
Veronica Murray, are you able to clarify? I think she wants to know if we have a ratio of diverse providers for our members.
Like how the provider diversity compares to member diversity, maybe?
Yeah.
Yes, that's a great question. And Veronica, I do have that, but I don't have it with me. So yeah, I'll follow up and send it to Brian to send out.
Okay, thanks.
Thank you.
Be sure to copy Rebecca, please, Erica.
Okay, got it.
So thank you very much, Erica and Moda Health team, for that presentation. Really some great insights into the things that you're doing and the things that you're working on doing for the future. We appreciate that. And as Brian mentioned earlier, likely we'll have you back to talk in more detail about how we can help promote some of those services via the PMAC, the council, and PEB in general.
Great, thank you.
So just a reminder, if you haven't moved yet, we have one more session. I'm doing my ropeless jumping rope here, you can see.
Your screen froze, so it looked like you were suspended in midair, and that's a move I just physically cannot do, Stephen.
Levitate. You've heard the song, right? Anyway, I've got these ropeless jumping ropes. You can see them here. And so you can use them in your office, whether you're at home or at work, and it simulates the jumping rope without the hazard of stepping on it or running into anything else. I find it's very useful in the course of a day. Anyway,
you say that until Brian accidentally throws one of those through his window when he's using them.
Yeah, good point, Brian. And your cats might want to chase the ball, the rotating ball too, right? So be careful with that. So a little comic relief, a little physical relief, hopefully. And we want to give Providence the full time that they have been offered at the very beginning. So without further ado, I'm going to turn it over to the Providence Health team. And thanks for being here.
Thank you so much for you all. My name is Cash Spencer, and sounds like based on the years that people have said today, I might be the old fogey of the bunch. I've been with PEB, or at least engaged with PEB now for just shy of 12 years. So since Providence picked up PEB back in 2010. So it's been quite a long time, a long journey, and it's always fun to see you all and to engage with you all. So with that, I do want to talk a little bit about our well-being resources. Now with me is my colleague, Megan Thompson, and I'll allow her to introduce herself as we get started. But we did take a somewhat different approach than the other carriers in that we wanted to focus a little bit on where we saw the biggest opportunity. So starting with the big buckets of areas where we saw the biggest opportunity to engage from a well-being perspective. I'll continue to monitor the chat, Megan, just to see if we can answer any questions. But also throughout this discussion, I will add a little bit of commentary on some of the programs, especially as it relates to what we've offered for PEB members. So with that, Megan, do you want to take it?
Megan, you are on mute. We're not able to hear you.
Uh-oh.
Yeah, she may be trying to call in. The call-in option's okay too.
Okay, she's the driver of the slides as
Okay,
well.
can
Ah,
you
there
guys
she is.
hear me
There you are.
now? 1 second.
Yep, I can hear you, Megan.
Wait, it's like, okay.
Can
Okay.
see you and can hear
Sorry.
you
Let
now.
me see. Can you hear me now?
Yes.
Okay, I can't hear. I don't know why it's not allowing me to hear other people. um, okay, well, I'll just get started, and then if there are any, I'll try to monitor the questions too. I don't know why other voices, I'm not like hearing them through my phone, but just sorry. Okay. Open up my PowerPoint again. Okay. So hi everyone. Thanks again for having me. And my name is Megan Thompson. I work on the health and wellbeing team here at Providence. And my background is in public health, and I've been with Providence for about 5 years, or a little under 5 years. So as Cash mentioned, we are taking a slightly different approach to how we present our topics today. We'll really be focusing on 3 key trends and focus areas for Providence and PEB. So I will spend time talking about behavioral health, diabetes, and musculoskeletal conditions. All right. So first off, so when we really think about the pandemic, it brought mental health to the forefront, and it's definitely tested our resilience. So across the country, we saw higher levels of stress and burnout, more individuals expressing loneliness, and we saw an increase in substance use disorders. And the additional grief and trauma and physical isolation of the past 2 years have really driven Americans to a breaking point. We're seeing, so before we used to kind of report out that 1 in 5 adults had a mental health condition, and just recent data, we're seeing 2 in 5 report symptoms of anxiety or depression, and more than half of Americans don't seek professional help for mental health issues due to stigma, access, and affordability issues. And here, as we talk about an opportunity for PEB, lack of awareness about services available through their employer. So looking at the right, we have seen pretty consistent trend with utilization of behavioral health care services. So right around that 23%. So we saw a slight increase in 2020, and it's remained pretty steady this past year. When we look at engagement in the different well-being programs that we offer, we see less than 1% of PEB members participating in these programs. So the programs that we have data on are our stress management health coaching program, which we saw decline over the past 3 years. And then we launched our behavioral health concierge program in 2021. And then we brought our behavioral health case management program in-house late 2020, which is why you see a big jump between 2020 and 2021. So at Providence, we offer resources across the behavioral health continuum, so your members and their families can really get the care they need. So in alignment with President Biden's national strategy, which you may have read or listened to during his speech earlier this month, we really aim to transform how mental health is understood, how it's perceived, and how it's accessed. So we're invested in the supply, diversity, and cultural competency of our providers, which Cash mentioned a little bit earlier in the chat. We're continuing to expand our digital options, which we'll talk about today, and increasing our navigation resources. so health education resources. So looking at this from left to right, so we offer some of those health education tools through our wellness platform, which is accessed through My Providence, as well as through the Providence blog, through our on-demand and live webinars, and then as well as our podcasts that our health coaching team developed. Looking at the next one, so we encourage members to relax and recharge by using their Life Balance and Choose Healthy discounts. So this is an opportunity to save on massage therapy, yoga, meditation, things like the Calm app are included in that. So those are the discount programs available to PEB Providence members. Moving to the next mental health program. So again, our stress management health coaching program. This is where members have the opportunity to work with a personal coach. They work one-on-one, and this can be over the phone, via email, or via video. And then we just this month launched our Learn to Live program. This is a digital program to help members overcome stress, social anxiety, depression, insomnia, or substance abuse. And I'll talk a little bit more about that in a moment. Our behavioral health concierge program offers virtual and confidential same-day or next-day appointments at no cost for members experiencing stress, anxiety, or burnout. Maybe they're struggling with the loss of a loved one, they're having child or parenting issues. That's a great resource. If a member is looking to work with a clinician, we offer a broad network where a member can search for the provider and then call the provider office to make an appointment. A referral is not required. And then, as Cash mentioned, we have the opportunity in our provider network where members can search by race and ethnicity, LGBTQ plus status, and cultural competency. But we also know here on the far right that sometimes members need help right away, which is why we've created a dedicated service team. So our crisis trained staff can help members with emergent needs, detox and substance use resources, understanding treatment options, staying safe, among other care needs. So as I briefly mentioned, our behavioral health concierge program was new last year. This is available to members at no cost in certain states, so primarily on the West Coast. So Oregon, Washington, Idaho, Montana, California, and Texas. And then I talked a little bit about this, but last year there were, let's see, I said how many members? Oops. 195 members participated in the behavioral health concierge program, and on average, they met 5 times with their provider. And the behavioral health concierge team, sorry, okay, go ahead, Cash.
I know you can't see or you can't hear, but just wanted to note that when we rolled out behavioral health concierge, it was really in response to the state of the pandemic. And so we piloted the program initially as a lot of our clinicians and our workers within our hospital facilities were dealing with the stress of just the amount of work that they had to do with the overrun within our hospital system. And so it was piloted there initially to reduce the stress on our caregivers within our hospital system. And then we rolled it out to PEB members in January of 2021. And we've since rolled it out and expanded it plan-wide to all Providence Health Plan members. So back to you, Megan. Just wanted to add that.
Gosh, there is another question, I believe.
Let's see.
It is, can Providence and other carriers, do they do group sessions for employee resource groups for grief or loss of loved ones, et cetera?
Yeah, that's a good question. I think so. I don't know the extent to which we offer group sessions, but it is a good question that we probably can take back. I'm not sure, Megan, if you know the answer to that, but we can certainly take it back. What we've been doing, because some of our other customers have asked us for resources for resource groups. So we've engaged with our delivery system partners on some resources that they have available. We've also started working with our care management. So Megan talked about more of our behavioral health care managers. We've worked with that department to create more specific trainings or behavioral health resources around certain populations. So for example, first responders come to mind. So we're creating a whole initiative around first responders. But for more general, broader resource groups, I'd have to take that away.
And just a note for the council and committee, this is probably a question that will be more directly relevant to EAP. And Cascade Centers is presenting to the Worksite Wellness Coordinating Council, I believe, in a couple weeks. So this is something, again, that we can bring up. And PEB's role is to facilitate those discussions. And if there are any opportunities for EAP or the carriers to offer something like that, then we would take those sorts of things through our normal renewal process and work with that to add that to our contract. So there is a process, but I do think EAP will have some relevant information. And then at the end of this meeting, we'll talk about the next steps and next meeting, and we can talk about the specific things we may want to accomplish in May and beyond.
Yeah, and Brian, that's a good call out, because even in the initiative that we're working on, not necessarily for PEB, but for another plan or another employer group, we're working directly with Canopy for that group in order to develop this first responder initiative. So Canopy has been a really good partner with us, formerly Cascade, of course. They've been a really good partner with us in developing some of that work with those groups in mind. But I can take it away to get you an answer on resource groups in general.
Thank you.
Great. So the last little piece that I wanted to mention about the Behavioral Health Concierge program is that they also, sorry, I have like some echo issues, sorry with the issues with my sound, but what I wanted to say is that they offer ongoing webinars on a variety of topics. So this year they're really focusing in on different topics. So April's class will be around compound grief, and May's class will talk about burnout, and those will be promoted in the PEB newsletter. The next program that I mentioned that we've just recently launched is our Learn to Live program. And this, again, helps members overcome social anxiety, depression, insomnia, stress, and substance use. These self-guided programs use CBT, which helps really improve access to mental health support and also eliminates that social stigma. This program also provides an interactive experience and encourages family, friends, and peer-to-peer communities to engage and offer social support. And Cash, you still had your hand up or your hand raised. Is there anything you wanted to add on this program? Nope.
No, okay. Sorry, my hand was just left up.
Okay, great.
Well, I do, sorry. So Megan did just mention that one was new.
So another program that we have that is planning to launch in 2023 is Equip. So the pandemic really intensified eating disorders with the number of individuals who were hospitalized almost doubling in 2020. So Equip is our evidence-based eating disorders care digital program. And that is built on FBT, which is family-based treatment. And again, it's planned to launch for members in 2023. This virtual model provides a 5-person care team, and they really help assist the family in structuring their home for healthy behaviors. So we're really excited to offer this program to members and tackle the impacts that eating disorders can have on the members and their families. All right. Moving on to diabetes and weight management. So 1 in 5 adults have diabetes and 1 in 3 have prediabetes. So the trend is moving in the opposite direction as most members with diabetes develop diabetes later in life. Americans with diabetes average over 16,000 in annual healthcare expenses, which is more than twice as much as members or individuals without diabetes. And the last bullet point there on the bottom, so diabetes prevention programs, they are really beneficial in helping reduce a member's risk for developing type 2 diabetes by 58%, which also will reduce healthcare costs and increase their productivity. So looking at the right, kind of a similar story that we saw with behavioral health. Diabetes care has remained steady over the past 3 years, with a little over 5% of your members diagnosed with type 1 or type 2 diabetes. And then looking at the bottom, again, similar with behavioral health, well-being, engagement, really low utilization of the programs that we currently offer for PEB members. So less than 1% participate in our weight management and diabetes care programs. So we saw, again, the weight management health coaching program participation decreased over the past 3 years, but we did see a slight increase in our diabetes care management program. We are excited to offer a couple new programs, which I'll highlight as I walk through what's currently available for members. So again, health coaching, that is the one-on-one over the phone or via email or via video, where a member works on fostering or losing weight through improving diet and exercise habits. And then healthy eating and active lifestyle program. This is our diabetes prevention program that took over when the Canary program sunsetted last year. So this is an interim program that is available to PEB members for 2022. And this helps members achieve moderate weight loss by building sustainable lifestyle behaviors like eating well and being active. The goal here is to achieve a 5% body weight loss and work up to 150 minutes of physical activity. This is offered in a group webinar format, and it is a year-long commitment, and members receive a free Fitbit. They get access to their coach and a peer support group. They get lessons over the course of the year, and it's really built and we really see really great results in this program. Our diabetes care management program is offered to members with diabetes, and our registered nurses, social workers, clinical support coordinators, and technicians really help members navigate their health plan. They provide personalized support based on the member's needs, behaviors, and motivators. Virta, which just launched in February this year. This is a provider-led research-backed treatment that can help reverse type 2 diabetes. And this is currently available to members with diabetes. And we're doing outreach to those members. And I'll talk about Virta in a moment, but I'll have let Cash jump in quick.
Yeah, I was just going to add on a little bit onto the Virta plan, that it is a PEB-only program right now. We have some short-term plans to roll it out to a much larger group, but at this moment, when we first rolled Virta out, it was very specific for those in a chronic type 2 diabetes situation, and it is by invitation only, so it's not available to all PEB members. And part of our outreach strategy is to engage the clinician. So having the PCP engaged with prescribing this to the appropriate diabetic member as well. So we're taking a number of approaches as it relates to Virta, because it is based on specific chronic type 2 diabetics with a higher level of BMI and on 2 or more brands of medications to manage their type 2 diabetes. So back to you, Megan.
Thanks, Cash. And then the last program that we currently offer for PEB members, and this is offered through Providence Health System, so non-Providence Health Plan members can also access this service, but the Health Management Resources Program is a clinically proven diet and lifestyle change program where for people who want to lose a lot of weight. It's the non-surgical solution that is offered through, again, the Providence Center for Weight Management. This is a medically supervised program. It's customized based on the member's goals, health history, and eating habits. So it's very nutrition focused. So talking a little bit more about Virta, again, this launched just last month, and it helps members make changes to their diet and in order to achieve nutritional ketosis, which is a natural state of the body that lowers the blood sugar and burns fat for energy. There's no surgery, there's no required exercise, and there's no calorie counting. With Virta's personalized treatment plan, each member gets medical supervision from a physician-led care team. They get access to a health coach. They get diabetes testing supplies. They get educational tools like videos and recipes, and they also have access to a private online support community. Virta provides around-the-clock monitoring and care. It's really easy to use. It's mobile and desktop friendly, and it really can be done from anywhere.
And the information is reported back to their PCP.
The next program that's in the work is our the OMADA program. And Amber at Kaiser kind of talked a little bit about this program, and it's currently offered through Kaiser. But this is something that the board is currently reviewing. OMADA is a diabetes prevention program. This will replace the healthy eating and active lifestyle program. And prior to HEAL, it was the Canary program. So again, this is really focusing on supporting members to lose weight and become more active and eat well. So members get access to health coaches, peer groups and communities, and virtual physician visits. They get a digital scale that automatically connects to their app and will automatically report the data and tracks progress in real time. And members get customized plans that account for social determinants of health that really encourage long-lasting changes to health behaviors. All right, moving on to the final topic that I will talk about from a condition perspective. So looking at musculoskeletal conditions. So more than half Americans suffer from back, shoulder, knee, and other joint pain. The US spends more than or nearly twice as much on MSK conditions as it does on heart disease. It continues to be, costs continue to rise and be a top driver for employers. During the pandemic, more individuals reported experiencing new or increased pain as many elective surgeries were delayed and employers transitioned to a remote work environment, so they didn't have a proper ergonomic workstation. So looking at PEB's utilization of musculoskeletal care on the right, we see it's actually declined a little bit in the past 3 years. So it's down about 3% when comparing 2019 to 2021. But again, really low engagement in the Wellbeing program. So we offer a pain management program through our care management team. And then again, we just launched Kaya Health last year, and we had 507 members enroll in that program, which is higher than any of the other Wellbeing programs that we've talked about today. So again, really speaks to the need or interest of PEB members in digital solutions. So let's talk a little bit more about Kaya. So Kaya is an evidence-based digital therapy app for members that are experiencing joint or muscle pain, whether that's back pain or elbow pain or knee pain. They get a customized therapy plan with curated exercises. They get mind-body relaxation techniques, educational lessons, and unlimited access to one-on-one coaching. It's a 12-week program that really adapts to the member as their fitness and mobility changes. And as I mentioned, there were over 500 members that enrolled in the first year, and we've seen really great outcomes from the program as well. So of PEB's participants, they reported experiencing 27% less pain and 43% improvement in sleep. And we really see these clinical outcomes across all levels of pain, from acute pain to chronic pain, which is great. And then we just got updated data today, actually, from Kaya, and another 75 members have joined Kaya in 2022, bringing overall enrollment into the program up to 582 members. So just 75 members in a couple months is really great. And then the second program we offer, I've talked a little bit about our care management program when I talked about diabetes. So again, similar, working one-on-one with the care management team based on their needs. So what's coming up with Kaya? So Kaya has expanded their offerings for 2022. They launched this program called Kaya Gateway, and this is where each member is screened using a clinical triage algorithm, which analyzes various clinical dimensions to really help identify those high-risk patients who may need more invasive or intense treatment. So those with medical issues or likely to elect surgery would actually be directed to a Kaya Health medical provider for further consultation before they could use the app. And by implementing this case review process, patients are connected to the right provider first, which can help reduce unnecessary elective surgeries and therefore reduce healthcare costs. Kaya also expanded their offerings and now includes content and support for chronic, acute, and pre-surgery care for back, neck, hip, knee, shoulder, hand, wrist, foot, ankle pain. So lots of different, really any type of pain, they're there to help and support you. Cash?
Yeah, I just wanted to add in on the Kaya Gateway. One of the things that we're piloting right now with our Providence rehab facilities is a program called CareSpace, which acts similar to the Kaya app. But what happens is if a person screens, say, red within the Kaya app, meaning Kaya is not appropriate, they may need a higher level of acuity, and they're referred to either a Kaya clinician to determine, no, you need to go into a doctor or you need to do something else, they can be referred to our Providence rehab facilities, and they then offer what's called CareSpace, which offers a more in-depth type of engagement through a similar gamified content through an app that also is driven based on our rehab partners. So it has a clinician focus. It has, a stoplight version of whether or not someone is appropriate for Kaya, but then there's also a Providence rehab providers that are also engaged in this to determine whether or not they really need to go straight into an in-person clinical setting, or is there still an opportunity to bridge the gap to give them something else that might be a little bit more intense, but not necessarily being there in the clinical setting. So still trying to steer members into more conservative therapies versus going straight to, drugs or surgery. So just wanted to add that little bit of information.
Yeah, thanks, Cash. So just the other couple bullet points here to expand upon. So Motion Coach, so this enhanced motion analysis. So Kaya uses Motion Coach, which is a computer vision technology that measures thousands of data points, like every time the user is using the platform, and it provides ongoing support in real-time PT grade feedback for the user. And then as far as improved integration workflows with existing care partners, so this means that Kaya has improved its referrals, single sign-on capabilities, incentive program integrations, and automated data exchanged APIs. So moving into member engagement strategies and talking a little bit about our approach to health equity. So Providence recognizes that there is a distinct need to provide health resources and address disparities among marginalized communities. As a health system, we provide more than 6 million people from all walks of life each year and are really committed to providing a respectful experience to everyone. So how we do that at the health plan, I'll just touch on some of this and you can read through it on your own time, but looking at those financial challenges that are faced by low-income workers, we provide access to resources such as medical and pharmacy cost calculators, telehealth services, and discount programs. We provide access to help members really achieve their healthiest life through programs like health coaching, diabetes prevention, care management, and behavioral health. We've already talked about the provider directory. We educate members on the benefits and perks through a variety of print and digital media throughout the year. We have a member website, we have a secure member portal, we provide a resource guide, webinars, podcasts, preventive care reminders, and wellness newsletters. We break down barriers to access through our affordable and high quality virtual care, such as Express Care Virtual and Behavioral Health Concierge. And then the final one, we provide reporting on your population's health status and utilization of medical and pharmacy care. So one thing that PEB can do to help members is we really encourage you by encouraging members to get the most of their health plan. So PEB has access to a custom web page that has an overview of all the tools and resources available to the Providence members. So all the different wellness programs that we've talked about today, the different discount programs and the perks that are available. They can also access My Providence, the personalized and secure member website. They can access the provider directory through this site, and this is an easy to remember link. It's providencehealthplan.com/PEB. And then My Providence, this is that personalized website where members can manage and access their health plan however and whenever they like. They can find in-network providers, estimate costs for pharmacy and medical care. They can view their claims and payment status, opt out to paperless, opt out of paper EOBs and opt in to paperless, being really sustainable. And then this is also where they access the health assessment for the health engagement model. So thinking additional ways that PEB can support to drive engagement into these programs. So some of these MODA and Kaiser have already talked about, but really thinking about the diverse communication strategy. So continuing to promote the webinars and events that are offered across Providence and our vendor partners in your monthly newsletter. Really expanding upon the variety of channels that you're using to communicate with your members. So thinking email, web, mobile app, push notifications, print, mail, lots of different avenues to reach your members. And then slicing and dicing by different populations within PEB. And we can certainly help support that. And then take advantage of the resources that are available to you. We are constantly creating new resources. We have webinars, we have employer and member-facing resources, resources for leaders, really how they can support their employees. So lots of free resources available to you as a Providence client. And then encourage your organizations to use the member resource guide when new hires come on board. And then as you think about the health engagement model in the future, consider incentivizing some of those care programs that we've talked about today, whether it's using Verta, whether it's using Kaya, our behavioral health concierge program, the Learn to Live program. There are lots of different ways, and these programs really do result in a return in value on investment and could help drive engagement in the program. With that, I'll pause if there are any questions.
I saw that Emily asked a question in the chat, and so yes, there are some options for accessibility for addressing members with limited internet, but not necessarily a home visit for those people. It might be a matter of phone calls to them to help them reach that support service. or helping them to get engaged with some of those other programs. As far as home visits go, we have done home visits, but not necessarily for the PEB population. I would have to take it away to see to what extent we offer home visits. I do know we offer it like on our Medicaid and Medicare population, so some of those government program populations that we serve. And we did do a number of initiatives with home visits during, the peak of the COVID outbreak. But to what extent we're offering home visits beyond that, we would have to take that away.
Any other questions from the council or PMAC members? If not, I'm going to thank Cash and Megan for your presentation and all the work you put into doing this. And again, you heard from previous presentations that we may be inviting you back to talk more in depth about some of your suggestions and services. And with that, I'm going to turn it back to Brian to bring it home.
Thank you. We obviously heard a lot of information today. There's obviously a lot of great programs out there for all of our members. And it's really a matter of how do we better engage our members? How do we speak to our members directly? As I mentioned, the April Coordinating Council meeting will have EAP present, Canopy, our EAP partner, as well as presenting some other, I think, HR information that'll speak to some of the challenges our members have gone through. We're working with Emily and others to pull together some information for our April PMAC meeting where we'll share, again, similar member experiences. And just a note for the carriers, feel free to attend those meetings. And listen to some of what's shared. I think in April, we're likely to touch on a lot of things or some things that are not necessarily within PEB's control, but that's okay. We just want to get a better idea of what are the struggles our members going through, all of the struggles that kind of stand in the way from them, receiving the care they need or being as healthy as they can or supporting their family. And I think even though we may hear a lot of things that PEB doesn't have direct control over, it's important to understand the overall situation our members are in. And to that, I'm hoping that conversation can lead to another conversation with our carriers about, based on all this information, can we, are there ways we can look at promoting or engaging differently? Are there ways that we can, have the carriers get maybe more direct feedback from focus groups about what's working or not working? In a way that's palatable and not necessarily in a public meeting. Anyway, so there are a lot of things that I'm going to be ironing out with Mercer, with Teresa, and all of our colleagues in the next couple of months. Are there any strong thoughts one way or the other about specific topics to cover next month and the month after? Or do you guys, do you approve of this approach? Do you like this approach? And Emily, your picture froze, and I can't tell if that is a positive reaction or a negative reaction. Okay, I think Emily may have dropped. Any other comments or thoughts? You guys can always email Rebecca and I afterwards and let us know if you have any different thoughts on the direction we're going, but I'm certainly open for more comments. And again, for the carriers, feel free to attend and listen in both the Coordinating Council and next month's PMAC meeting if you think it would be valuable. And either Mercer or myself will be reaching out to you sometime in the short future to discuss, what we want to do in the coming months. So with that, if there are no questions or comments, have a wonderful, safe afternoon, everyone. And thanks again for the carriers for the great information. Thank you for Mercer for facilitating. And I hope everyone has a happy, healthy, and safe rest of your afternoon. Take care, everyone.